Hi, everyone. My name is Brittanya Brown, and I'm the National Communications Director for Families with Safe Streets. I want to welcome you to our live stream premiere of Safety Science 101, featuring esteemed road safety expert Jessie Singer from New York City. If you haven't heard about what we do here at Families for Safe Streets, I want to let you know that it is simple. We are here to help those who are impacted by traffic violence and traffic crashes. Many of our members have lost family, loved ones, and also are leaning into the strength that we're building at our on our national movement so that we can talk about safety science in our communities. For many of us, this work comes from deep personal loss, and we're here tonight to not only honor our loved ones taken by traffic violence, but to also take action so that no one else has to experience this pain alone. This film features Jessie Singer, who's a road expert and the author of There Are No Accidents, and it explains what we believe is the approach that needs to be taken on a national level, safe systems approach. A proven strategy that is proven time and time again to shift the focus away from blaming individuals and holding the system accountable for our roads, our vehicles, our policy, and our people. We're going to watch the short film, and it takes about 15 minutes, and I hope that you'll indulge in our comment section on YouTube, as well as on Twitter, Facebook, and Instagram to let us know how you're taking this in. I'm going to share my screen, and I appreciate your grace while doing so that we can watch this together. Please give me one moment. I'm going to quickly test if this is live and we can hear. Give me just a moment. It looks like the video is not playing. I'm going to make sure that everyone in the live stream can see it. Give us 1 second. We are trying this for the first time. We might have to relaunch. Okay. Share screen. And I see that we have people who are joined. Please give us just a moment while we put this video on and make sure everyone can hear and see it.
Families for Safe Streets is frequently asked, what kind of issues do you work on? And what don't you work on? How do you decide? The short answer is something you might not have heard of: safety science. The rest of this video explains safety science, how it can guide decision-making about which issues and policies we fight for, and why, thanks to the automobile lobby, you might have never even heard of it. And that's why I am here. My name is Jessie Singer. I am a safety expert and the author of There Are No Accidents, a book about the word accident and the rise in these so-called accidental deaths. I'm also a longtime supporter of Families for Safe Streets and someone who lost her best friend to a drunk driver. FSS asked me to step in today to explain safety science and how it relates to the crisis on our roads. To help you understand safety science, I'd like to start by asking you to put aside traffic and transportation for a second and instead think about workplace safety. Consider this. If you work in a factory, who's responsible for your safety? And if you get hurt at work, who's responsible for that? The answer in both cases is your employer. Employers are responsible, legally and financially, for the safety of employees. And because of that, our workplaces are generally safe. Our workplaces have fire exits, emergency stops for heavy machinery, and a million other systems that keep people safe while working. And all of that is why, when you hear, say, that a worker was injured in a factory fire, you don't ask, was the employee playing with matches? You ask, why didn't the factory have safe fire exits? When we hear of harm or injury in a workplace, we don't look at individual behavior, but the conditions that individuals face. This idea is at the core of safety science, and it has guided our decisions about keeping workers safe since the early 1900s. But the same is not true of our roads. When you're driving, walking, or biking, who's responsible for your safety? And if you get in a crash, who's responsible for that? The answer in both cases is you and you alone, or perhaps some other person on the road. Not automakers, not road engineers, not government officials. No, individuals are responsible, legally and financially, for the safety of themselves and others on the road. And because of that, our roads are generally unsafe because we are hyper-focused on individuals' behavior and decisions on the road, and not on the conditions people face on the road. And all of that is why when you hear, say, that a pedestrian was killed crossing the street or a cyclist was killed in a bike lane, you don't ask, was the road wide and straight and designed for speed? Was the bike lane protected? No. You ask, was the pedestrian wearing dark colors? Was the cyclist wearing a helmet? Was the driver speeding? Where our workplaces are made safe by safety science, our roads are kept unsafe by an intentional disregard of the same ideas. If someone makes a mistake or bad decision at work, they're protected from harm. If someone makes a mistake or bad decision on the road, though, it's a death sentence for them or someone else. Let's dive in. This is Safety Science 101. At its most basic level, safety science demonstrates the efficacy of focusing on changing the dangerous conditions that people face, rather than attempting to prevent people from making mistakes. Going forward, it'll help us to understand the difference between two words: errors and conditions. Errors are mistakes or bad decisions, typically made by those closest to the injury. Conditions are environments, whether built, social, or economic, that are typically controlled by people far away from the injury. For example, when we talk about workplace injuries, we talk about the conditions that people face: long hours, slippery floors, heavy machinery, controlled by the owners of the workplace. When we talk about road injuries, we tend to focus on the errors that individuals make: speeding, being distracted, or driving drunk. This difference between errors and conditions can be understood as two different ways to understand the problem and two different ways to approach the solution. If we think that the problem, the cause of injury, is errors, then the solution is to change people and their behavior with education and enforcement. But if we think that conditions are the problem, the cause of injury, then the solution is to change the conditions that everyone faces. The former is what we do in the US to keep roads safe. And the latter is what all of our peer nations do to keep roads safe. Which is why today, US traffic fatalities are rising, and traffic fatalities in our peer nations are falling. In our peer nations, this focus on conditions, not errors. It's what's known as a safe systems approach. A safe system accepts that people are imperfect. When you build a safe system, you are planning for people to make mistakes and bad decisions. This is done by understanding that education alone or personal responsibility alone cannot keep people safe. Instead, a safe system seeks to reduce the consequences of errors. So, how do we do that? In general, the idea is to cushion the blow of our mistakes, to slow the speed, reduce the impact, and limit the likelihood of harm, rather than trying to perfect people's behavior. At the core of this process is an understanding that no singular solution to the problem of traffic violence exists. Rather, we can protect people from the consequences of mistakes and bad decisions through layers of safety measures. Safety science typically uses Swiss cheese, as a metaphor to explain this. This is what is known as the Swiss cheese model. Here's how it works. Imagine a stack of Swiss cheese. Now, every slice of Swiss cheese is full of holes, but if you stack up a bunch of Swiss cheese, the holes don't all line up, right? Imagine that each slice of Swiss cheese represents a different safety measure. One represents the anti-lock brakes in a car, another the crosswalk and traffic light, another the speed limit. Each safety measure limits risk. None keep us safe alone. Only when multiple safety measures are stacked together are we wholly protected. But also these systems are imperfect. Anti-lock brakes can fail, people can make mistakes and bad decisions despite speed limits or traffic lights. In the Swiss cheese model, these potential failures are represented by the holes in the Swiss cheese. If we stack our safety measures, if we stack our Swiss cheese, then when risk slips through one hole, when one safety measure fails, the risk trajectory is stopped by the next piece of cheese. We are protected by the next safety measure before injury occurs. Generally, this helps us see two important truths about safety. One, there is no singular solution to the problem of safety. And two, safety failures like a traffic crash cannot be traced back to a single cause. Both safety and danger are the result of multiple factors. And this is why it is so important to focus on the big picture, on upstream solutions, safety measures that affect the systems that we all use to travel from place to place, and refrain from approaches that focus on individual behavior change. Because it's never just the fault of one person making one bad decision. And if that one person had made a better decision, it would still leave in place the dangerous conditions that will eventually lead to harm. It's important to pause here to point out that our brains are primed to ignore everything I just said. Humans are hardwired to seek out individual mistakes as a self-corrective measure. There's a wealth of psychological research that points to this error-seeking urge, especially when it comes to other people's mistakes. This is in part because it is deeply comforting to find someone to blame, especially in the case of a horrible event like a fatal traffic crash. And everything we're taught about traffic safety, from government PSAs to car advertisements, reinforces this error-seeking urge. Both our basic psychology and everything that is communicated to us about traffic safety points to the idea that traffic violence is caused by dangerous people, not dangerous conditions. The inverse is reinforced as well. The idea that traffic violence is prevented by perfectly attentive, perfectly trained, and perfectly behaved drivers, cyclists, and pedestrians. None of that is true. But it is cathartic to think so. It feels good to find someone to blame and to pretend that traffic violence is a matter of personal responsibility, because it is a way of protecting ourselves from the frightening idea that the same thing could happen to us. Finding someone to blame is a way of saying, it couldn't happen to me because I know better. And while emotional catharsis is important for any political movement, particularly one like this that's rooted in trauma, it cannot be our principal aim. We are focused on preventing the next death on our roads, and we have a responsibility to understand and fight for what works. So we must set aside the idea that we can perfect any individual's behavior and think broadly and systemically about how to reduce the harm of everyone's mistakes. Safety science also provides us with a way to think about the relative effectiveness of different types of interventions. Let's take a look at the hierarchy of controls. Now, this is a tool that is used by the federal government to assess how to choose safety measures for the workplace. It is a great example of how safety is treated differently in different areas of the built environment. For example, if toxic chemicals were being released into a workplace, we would first try to eliminate them, then substitute them for safer chemicals, then build ventilation systems to limit exposure. Then, lastly, and least effectively, we would have employees wear masks or try not to exert themselves while working to reduce inhalation. Now, let's apply the same metrics to traffic safety. For example, if speeding was a problem on a local road, what would be your first response? We'd put up signs that encourage seatbelt and bike helmet use. We'd tell people to look both ways before crossing. And we'd ask police officers to punish people for speeding, right? And that's pretty much the exact opposite of what the hierarchy of controls would tell us to do. And the exact opposite of what we would do in the workplace. For our roads, we would choose the least effective controls that require the most work to protect people. Now, imagine if we attempted to solve the problem using the hierarchy of controls. First, we would eliminate the ability to speed with technology like intelligent speed assist. Next, we would provide safe sidewalks, bike lanes, and bus lanes, substituting the hazard with safer, slower modes, and engineering the road to separate people from the hazard. And only after all of that will we try and educate and enforce the problem away. It is no coincidence that we react so differently to safety failures in different areas of the built environment. I'm going to condense a lot of history into a few words. So at the turn of the century, when workplace deaths were skyrocketing, unions and reformers pushed for laws that made workplace safety the responsibility of the employer. They set standards to define safe conditions in the workplace and put a cost on the job injuries that employers were required to pay. A few decades later, when traffic deaths first began to skyrocket, automakers aggressively lobbied for the opposite, fighting against standards that would make cars safer for passengers and pedestrians. In place of efforts to mandate that cars were safe for people inside and out, automakers instead pushed for laws that made traffic safety the responsibility of drivers and pedestrians, and popularized the idea that traffic crashes were caused by bad drivers and bad pedestrians. With advertisements and aggressive lobbying, the auto industry pushed two caricatures into the lexicon: the jaywalker and the nut behind the wheel. The idea was that cars were perfectly safe, if not for all those dangerous jaywalkers and nutty drivers. And this is why, long before we required seatbelts and anti-lock brakes in cars, we had laws saying that jaywalking was illegal. And if someone was hurt in a car crash, it was the fault of the driver or pedestrian, not the person who designed the road or made the car. Now, that's all old history, but today, a growing number of people know that the most effective way to prevent injuries and save lives are to physically remove hazards, replace hazards, and separate people from being near hazards, long before we try to change individual behavior. And we have ample evidence that this is the right choice. Let me give you a few examples. Here's one. Comparing US traffic fatalities to our peer nations. We like to think of traffic crashes as a matter of human error, but fatal traffic crashes occur at a much higher rate in the US than in any of our peer nations. Do people in France or Sweden make fewer errors than Americans? Of course not. We face different conditions. Or consider how Texas has a higher traffic fatality rate than California or New York. Are Texans worse drivers than New Yorkers? Do they make more errors than people in California? Of course not. They face different conditions. Now, let's look at what those conditions could look like. This is Broadway, a street in New York City. Car access was eliminated from large portions of the street in 2023, when much of the street was transformed into a pedestrian and bike-only corridor. There has been a 100% reduction in fatalities on this part of Broadway since implementation. This is what happens when you remove the hazard entirely. Your safety measures are completely effective. So that's how you eliminate a hazard. Let's look at substitution. Consider 14th Street in Manhattan. This street was made into a bus-only corridor in 2019, replacing tens of thousands of individual vehicles with a smaller number of efficient buses and local traffic. Not only was bus travel more efficient, but by substituting car travel with bus travel, crashes and injuries fell by more than half. An example of engineering controls or isolating people from hazards is your standard complete street. Here you can see how cyclists are given a safe space to use the street and pedestrians are given shelter on pedestrian islands. This type of intervention reduces injuries and crashes, but it also changes behavior, reducing speeding and cycling on the sidewalk. Now, administrative controls can include everything from leading pedestrian rules, which give pedestrians the walk sign a few seconds prior to giving drivers the green light, to speed safety cameras. These traffic safety measures are effective, dramatically reducing crashes and fatalities, but only at the locations where they're implemented, which is why they fall lower on the scale of interventions. Personal protective equipment and education about personal responsibility are the least effective forms of intervention, whether that's public service announcements or bike helmets. These interventions have a much slimmer chance of protecting people, and even that potential protection is only possible if people notice them and choose to participate. Now, should individuals be vigilant and careful? Of course. But there is no evidence that telling people to be vigilant and careful has any effect on outcomes. There is no shortage of things that can be done to make our streets safer. And by understanding safety science basics, we are empowering ourselves to focus our limited time and attention on the ways that save the most lives. But there's a critical first step, and a difficult one, to applying safety science on our roads. We have to set aside blame. We have to look beyond the allure of personal responsibility. We have to think bigger than any one person and what we did wrong, and look at the big picture, the conditions that we all face, and focus on protecting people from harm, even if they make a mistake or bad decision.
Thank you all for joining us for the premiere of our new safety science film. I appreciate your patience as we are doing this for the first time, but we're hoping to reach people who want to learn more about what we mean when we say safe systems approach. If this video interests you, we'd love to hear your feedback in the chat. And also, we delayed the YouTube premiere, so if you missed any of it here, it'll be available on replay on Facebook, Instagram, Twitter, or X, and also YouTube. I want to tell you about something that we're launching alongside of the premiere of our safety strategy, safety science. We're releasing a strategy called a house party, where we're hoping that we want to make this easier for people everywhere to bring this film into their communities, whether it's with a few friends in your living room or a local advocacy group or alongside families who are also grieving, who want to understand what language they need to name the injustice that they feel. We've been working hard at Families for Safe Streets National, and we've created a toolkit to help guide these conversations, as well as including discussion questions around this video. We're hoping that members, advocates, supporters who want to share safety science in their communities will be able to lean in with us and get planning tips on how to host events in their communities. And the good thing is, you've probably hosted a house event before. So it's just as easy as you sharing this in your living room, again, with your family, your children, cousins, uncles, any type of gathering. If you want to bring people into the community that we know as Families for Safe Streets, we support those who have been directly impacted with more than just advocacy. We support it with services that bring us all together so that we can continue to talk about this and help prevent these unnecessary tragedies. We've created a toolkit, and we hope that this will provide a gentle on-ramp into advocacy for anyone who's interested. There's a way for us to gather, grieve, as well as envision and push for the change that is needed, because we know that traffic violence is 100% preventable. We hope that you continue to plug in and watch this premiere on YouTube again. If you missed it, sign up for any of our roundtable events that you'll see in the discussion on Facebook, Instagram, and Twitter after this. We're going to be having more conversations on Thursday, August 21st, where we'll be debriefing this with Families for Safe Streets chapters, members, supporters, allies, and national advocates. And we hope to help anyone who's interested in hosting one of these events in their communities, planning towards this through November's World Day of Remembrance for road traffic victims. If you can't make the roundtable, please feel free to share any of your reflections about our new safety science short film at info@familiesforsafestreets.org. Tonight, we appreciated you leaning in with us as we continue to remember those who we've lost, as we continue building the movement that will save lives. Thank you for being here, and thank you for showing up. I wish you well.